Hey guys, we're just going to do a quick, easy video on Lucas operation. It's a super easy machine to operate. These are just some tips that'll make it a little quicker and easier for you. It's always here in room 6 on the table. Just make sure that your battery is good before you start. If it's not, you may want to just bring the power source and have it plugged in as well, but it should give you an indicator, right, your battery indicator right here. Unplug it from the power source, which is underneath. Again, bring the power source with you if it's going to be a long CPR or your battery's already dying. Unzip this thing. You have your two sides. First thing you're going to want to get out is this backboard. The backboard, you want to make sure it's centered on the patient, kind of flush up against their armpits on the backside. The easiest way to accomplish this, if you have the people to do it, is have one person on each side of the patient, have them grab an arm on each side of the patient, pull them up so that their back clears the bed, just enough for you to scoot this underneath. Bring the patient back down slowly. You can kind of fine tune your adjustment to make sure it's centered on the patient, and that's the easiest way to do it. Essentially get the patient from laying flat and bring the back up off the bed so you can slide that thing under. The log roll is a little bit more difficult. It'll require more adjusting once you roll the patient back onto it, so save you time during a chaotic code. Just try to get their back up off the bed. Come back to your Lucas machine. It'll be on this side. You want to power this on when you grab it. I like to grab it this way so that you can use these yellow eyelets to pull back and make sure that these locking mechanisms are clear. Sometimes during storage they tend to close up like that, and what will happen is during your code, when you bring this over, you'll go to click this on and it won't be able to grasp the metal. So as you're pulling this out, powering it up, just make sure these are clear. Bring it over. You're gonna click one side. You'll hear an audible click. It's secured. The next thing you're gonna do is hit number 1. Up here you have basically, it's a really simple operation. Number 1, number 2, and number 3. 1's gonna be your adjustment. 2 will fine tune it and pause it. And then 3, you've got, the top one is gonna be continuous. That'll be 30 and 2. So for our application here in the ER in the hospital, this is gonna be your continuous button on the top. So you hit number 1, you're gonna be able to pull this plunger down to adjust to the patient's chest. It gives you a diagram on the backboard where you want to center that suction cup, which is going to be that mid-sternal right between the nipple line. Bring down your suction cup. If this patient is too small or too big, as you bring it down, the machine's going to give you an audible error noise like that. You just have to go back to manual CPR on those particular patients, but most patients this works. Bring it down to where you need it. You're going to come back up here, hit number 2. The machine will fine-tune itself. Go to number 3, hit your continuous, and it'll start compressions. This can go until the doctor gives you like a 2-minute. I know they don't do 2 minutes here, but whenever the doctor wants to pause for rhythm or pulse checks, come back up here, hit your pause button. If you need to make any adjustments to the placement on this, say the backboard's out of position or whatever, go to your pause. You can come back to number 1. This will allow you to pull the plunger back up, make whatever adjustments you need, come back down. Hit your number 2 to set it again, and back to number 3. During CPR, if you guys need the patient's arms up and out of the way for transport or any other movement, there are these straps on the sides. Essentially, the patient's arms will come up like it's hugging the Lucas machine. You can secure their wrists or forearms into these straps. It's just one more thing to keep out of the way if you guys need it. Other than that, once the operation's complete, whenever you're done with the CPR, come back up here, hit your pause, number 1, bring your plunger back up, shut this down, and then you can disconnect it. This plunger under here is replaceable. They're inside the Lucas machine, and then they also have them in the restock here in room 6. Wipe the machine down with bleach or whatever wipes you can use to clean it off, and make sure it's plugged back into power. That's the quick and easy way to operate the Lucas Pretty Easy machine.